Hi, welcome back to my channel. My name is Sarah and I'm a family nurse practitioner. I've been a nurse practitioner now for a few years, and talking to some of my fellow coworkers and other bedside nurses, I hear so many who are hesitant about making that transition from being an RN to an NP. So in today's video, I wanted to talk to you about all the reasons why I love being a nurse practitioner more than a bedside nurse. So as a bedside nurse, I worked in the ICU. So I probably worked in the most autonomous unit for a bedside nurse. But even still, I was limited to what my scope would allow. So I would make suggestions. I would refuse certain orders that maybe I didn't feel comfortable carrying out. I would talk to the doctors. I would be involved in rounds. I was limited. I was so busy carrying out tasks and doing other things, and obviously limited by my scope, that my job didn't include making treatment decisions. So in contrast, now I'm the only provider in my clinic. I have 2 medical assistants that work with me, so I have complete autonomy. I do have a medical director, and she's awesome. She's always available if I have a question about something or I want her opinion on something. But otherwise, I'm on my own. It's just me and my books, me and my resources. So I would say that having so much autonomy it's really given me a greater sense of confidence. When I first started as a nurse practitioner and I put on that white lab coat, I had imposter syndrome. I felt like, who am I to be making these treatment decisions for these patients? Like, who am I to be, educating somebody about something or telling somebody they should or shouldn't do something or prescribing medication? It was definitely a shock. I did not feel confident. I felt like a child wearing this big coat, and having this title that just didn't seem right. But I would definitely say that kind of being thrown into the fire and being on my own and being forced to make some of those decisions when I didn't feel 100% confident definitely helped me build that confidence and helped me feel like, okay, I belong. I'm supposed to be a nurse practitioner. I am totally qualified to be making these decisions, and this is exactly where I'm supposed to be. So it's been awesome. All right, so I'm going to sound like a little bit of a negative Nancy with number 2, but it is what it is. So number 2 is more respect. So I think all bedside nurses know, and I know because I have many, many years of bedside nursing experience, we all know that we get treated like maids and servants, okay? There's no respect there. You hear so much, oh, thank you for being a hero, and thank you for caring for people and whatnot. But inpatient, it's a different story. You don't feel that appreciation. You don't feel that true level of I'm grateful, for what you're doing for me. Bedside nurses are just so underappreciated, and it's not right, but that's just something that I didn't really see changing. It's something that we just learn to kind of cope with. When you're working at the bedside, you're just like, hey, this is the nature of the game. You learn to grow thick skin, but I kind of felt like it was kind of a toxic kind of environment. Like, why do I have to have thick skin when I'm at work? It comes with the territory, but I shouldn't feel like I have to have thick skin coming to work. This is somewhere that I'm spending the majority of my time. So to have to deal with that at work, the lack of respect from not only the doctors, but patients and family members as well, it was just too much. So let me give you the other side of things. So now, having experienced both, I would definitely say that for the most part, I do feel like I have that respect as a nurse practitioner. And patients actually value my opinion. And this is in contrast to when I was a bedside nurse. Patients would ask me questions. I would give them a very thorough explanation of everything. And then after I'm done, I'm off my soapbox, they would say, oh, let me speak to the doctor about that. And no, I'm not knocking any doctors, but like the resident would come into the room and say the exact same thing that I just finished explaining to the patient, and they'd say, oh, okay, doctor, as if what I said just in one ear and out the other. It was like so frustrating. Now patients respect what I have to say. They listen, sometimes comply. It just seems like they're actually listening when I educate them. And I would say that it's just nice to be treated with respect and appreciation. All right, next up on the list. Actually, this might be like the most important one. It's petty, but it's like the most important one. No drama. So working at the bedside, I think, was like a soap opera. Every shift. Between, nurses arguing about assignments, who's got the harder set, who's got the easiest set, who didn't go to CAT scan, who didn't put a label on some tubing, who didn't empty their canisters. I've seen emotional breakdowns at the nurses station. I've seen full-on arguments. I've seen people cursing each other out. I think I've witnessed everything at work. So if you're the type of person that kind of thrives in that environment and you love the drama, you live for the drama, then more power to you. But that's just not me. I like to come to work, do my job, and go home and live my real life. Work does not consume my life. Work is not life for me. Life is life and work is work. And I like to kind of keep those separated. So coming from that standpoint, you can understand why I just can truly appreciate not having any drama at work. I spend so much time formulating treatment plans for my patient. I'm calling patients back with test results. I'm seeing patients that walk into the door. I'm providing excellent care. So that alone disqualifies me from being involved in any drama anyway, because I'm too busy. And I can appreciate that because it helps my shift go by faster. And I just don't have time. I ain't got time to be dealing with nonsense at work. So I just love it. My final reason for appreciating being a nurse practitioner more than a bedside nurse is finally being treated like an adult. So, as a bedside nurse, I was forced to work every other weekend. I had to clock in. Not a minute later, it was the end of the world. I couldn't necessarily just, take days off when I had some kind of an emergency. I had to call in, and then there are consequences for that as well. I think there was just an unnecessary emphasis placed on very petty, minuscule things. So in contrast, let's say I have a doctor's appointment, or I have something that I want to do with my kids, or I have a family day planned, or if me and my husband are going out of town. The scheduler asks me if I have any days that I absolutely can't work. I let them know, and they just don't schedule me on those days. So they treat me like an adult, and they actually understand that, oh, I have a life. Oh, I have a family. Oh, I have children. I have things going on. I decide when's the best time for me to see my patients. I have discretion over how the flow of my day goes. So at the end of the day, as long as my notes get signed and I bill correctly for my services, I have the flexibility to kind of structure my day how I see best fit. And I have the flexibility to not have to worry about the petty things. And I can truly appreciate that. That's something that I did not have as a bedside nurse. Okay, so these were my top 4 reasons why I love being a nurse practitioner more than a bedside nurse. So please let me know your thoughts in the comments, and I'll see you in my next video.